I suffered stroke while I was in secondary. Most of the time I spend my time in hospital rather than in studies, reading, and it was very hectic.
Mental health is just about being there for someone, showing them that they're not alone and we can fight this together. I started this journey about 20 years ago. I had a domestic manager who had a child with sickle cell. So we'd come, go to Jaramogi, and while in Jaramogi, we'd interact with other sickle cell warriors. And through that journey, I started the organization, Zuwi Afya CBO. Zuwi Afya is a youth-led group that was started in 2021.
Passion for service, for me, it's not just about money. It is about seeing the smiles on the warriors' faces.
We have 4 thematic areas. Our main thematic area is health. And under health, I focus on sickle cell disease. Sickle cell is a condition that affects the mind because the kind of pain the sickle cell warriors go through is alarming. And people do not understand sickle cell. Sickle cell, even a little stress, just shouting at them, going to school, exams, even the little things as even menstruation. That pain, any form of pain, when a man breaks a sickle cell warrior's heart, that is enough to give them crisis.
I'm a person who is determined in life, but my determination really was affected with sickle cell because every now and then pain was there. Hadi nikisema nakohoa hivi, kichwa ishaanza kuniuma, na hivyo ndivyo crisis imeanza.
Since I met Zuwi Afya, I've been relieved because nowadays I don't buy my medication.
When I met Zuwi, I met people who understood me, people who gave me comfort. Before I felt isolated and depression crept in because no one understood me. But now I can be me, I can be myself. No need to hide.
We have been supporting the sickle cell warriors with their medication. Every single drug that they take, hydroxyurea, folic, paludrin, Pen-V, any painkillers, supplements. We have a nutritional flood that was introduced by our welfare manager, and we've ensured that the warriors go without, they do not lack, they get the medication.
Our partnership with Zuwi Africa is to give medicine to the warriors and to make sure they are well cared for.
We also focus on other non-communicable diseases like HIV and AIDS. And under HIV and AIDS, we focus on the sex for fish trade. That is very rampant in the shores of Lake Victoria, where the girl child is forced to sell herself for just as little as fish. And by fish, we mean they're able to be given money so that they can support themselves.
One of the biggest milestones that I will say has made us this year is the fact that we were able to table our voice in the parliamentary sitting, whereby we had demanded, quotes and quotes, that these warriors get their medications for free. Just the way HIV used to be treated, we want the same for these sickle cell warriors. We want them to walk into a facility and get their medication free of charge.
Our other thematic areas are climate mitigation. Under climate, we cover waste management, where we collect waste and we segregate it at our small farm in Mamboleo, and we're able to put the organic waste into our land. We till land. That is more of our sustainability. So we till land and put up local vegetables, and we're able to sell them to the restaurants like Kosewe and the likes, and at least get some little money to enable us to support our other initiatives. Our other thematic area is social economic empowerment. We don't just get the warriors and the community healthy, but we also train them on skills. And from those skills, we teach them how to make samosas, culinary skills. We make the reusable pads. from those skills, at least they're able to go and sustain themselves. They're able to make money for themselves.
Our welfare also makes yogurt. She has trained them on how to make homemade yogurts, which they are given to go and sell. Whatever they get from the yogurt goes back into their pockets. Part of it also goes back into the kitty, where they're able to get their medications for free.
Our fourth thematic area is inclusivity. As you have seen, we have quite a number of warriors with disability. We do not bias. We support everyone and anyone, whether you're in the LGBTQ community, whether you have disability, whatever inclusivity that is needed, we include you in our organization.
By the time I was found sickle cell positive, the issue of SHA wasn't around. It was not introduced.
Sometimes we lack drugs. Then when they come, they get nothing. So the finances is our challenge because we doesn't have any donor.
Our biggest challenge is funds. There's also, of course, stockouts of the medication. Currently in the country, there's a shortage of hydroxyurea. In such incidences, we have to import the medication, which comes with a very heavy cost. So what I'd really wish and hope that we could get a chance to get some funding so that we are able to have our own sustainability and be able to support our warriors 100%.
I can say Zuwi Afya has given me meaning in life because it has protected me in several ways that I've never seen.
We've enabled them to get back into their school spaces, and some of them are actually employed within our spaces. One is also employed at the pharmacy where he helps, he is a cashier, he runs the day-to-day activities of the pharmacy. So we are not only just getting them well, we're also giving them a space where they are able to empower themselves economically.
People who don't know about sickle cell, they should know that sickle cell isn't a curse. Sickle cell, nowadays people live with it for a longer time.
Before getting married or getting kids, kindly mpime, mujue status zenu, so that at the end of the day you don't hurt us as kids in the name of blaming our mothers.
If someone wants to volunteer, our offices are next to Rotary Vocational College at the Youth Empowerment Center. You can also reach me on my number 0799 504 897. We also have an account with Equity Bank. Our pay bill is 247. Account number is 504 897. This information is on our various social media platforms, on our website, on TikTok, on Facebook, and any of our platforms. Thank you.